let's start with robotic surgery. Tell me about robotic surgery.
Yeah, robotic surgery is basically a misnomer. It is robot-assisted surgery because a lot of people think it is the robot doing the surgery. It's not true. We take the assistance of robots only because humans have some limitations. So in order to avoid the human restrictions and limitations, robots help us, like we can reach inaccessible areas inside the body using robotic arms, because our arms are not as long as robotic arms. So if I need to do some, tackle some pathology way behind, deep inside the throat, the robotic arm will help me because it's like a long snake-like arm. And the other advantage is the robotic arms can move 360 degrees, unlike human arms. We have a limited range of motion, whether it is wrist or elbow or shoulder. We can only move to a certain range, whereas robotic arms can take an entire 180 or 360 degree movement. So there's 7 degrees of freedom basically, which humans don't have. So this is the other advantage of robotic surgery. And there are other advantages, like robotic surgeries will add on to huge cosmetic benefits, like we do scarless procedures. Like normally a thyroid surgery involves a long cut in the neck, whereas in robotic surgery the scar is hidden, it's in the armpit. So, this is of immense benefit. Patient satisfaction, gratification is so much because they don't see any scar on their body visible. And so the world doesn't have to know that you've had a surgery done. And there are many other huge benefits, like there is no blood loss during surgery, or the blood loss is very minimal because there are certain inbuilt mechanisms inside the robotic console that we have. And there are other benefits as well, as like short stay and this minimal infection rate, because we are not directly handling the tissues. The surgeon has to know his anatomy well. The surgeon should have performed several surgeries before taking up robotic surgery. And every step of surgery is the same as traditional surgery. There is no difference in that. It's just that, as I said, it is minimally access surgery, which means without giving any large cuts or incisions, we are able to reach inaccessible areas and do good surgeries, also because it gives us 10 times the magnification. So the surgeon, unlike in traditional surgery where there is naked eye vision, here there is 10 times magnified vision. So there are several ENT ailments. Actually, in the region of ENT and head and neck, there are more than 1,000 ailments. You'll be surprised. Most people think it's only common cold. Whereas, starting from the ear, let us discuss, for example, in ear, there could be a perforation in the eardrum. There could be a disease called cholesteatoma. There could be bleeding vascular lesions called glomus tumors. And there could be, brain fluid leaking through the ear because of some defect in the bone. And there could be various malignancies in the ear. There could be cancers which are arising from the temporal bone and presenting in the ear. So there are various conditions like fungal infections. Similarly, in the nose, we have polyps and crooked, deviated nasal bone, which can cause obstruction. And there could be, again, other conditions like fungal infections, rhinosporidiosis. Again, tumors of the nose and sinuses are known. We receive a lot of patients of sinus cancers also. And in the throat, again, starting from small lesions like vocal nodules, there are nodules or polyps in the vocal cords, or they can be, malignancies in the entire throat, like, starting from the cheek to the tonsil to the tongue, tongue again, front of tongue or back of the tongue, like we call it base of tongue, or it can be larynx, that's voice box cancers. So, again, there are immense conditions. There are even rare conditions like granulomatous diseases. And so there's, people are not usually aware of the extent of pathology or diseases that can manifest in mankind. And that is why, any alteration in symptomatology or any new symptom, I would advise all patients to reach the doctor.
Okay, great.
And snoring.
1 second, snoring.
Again, snoring associated with sleep apnea is a dangerous condition. Many people think snoring is a good thing and it's a normal thing, whereas snoring is associated with this dreadful condition called sleep apnea. Sleep apnea is where the patient is snoring and multiple times there is pauses in breathing during sleep. And that's when, a patient has jerky movements during sleep, not knowing that the oxygen is falling now and then. And the sleep apnea is the root cause for several disorders. Like such people have 10 times the risk risk of developing heart attacks and brain strokes and cancers. So if sleep apnea is diagnosed at a very early stage, you can even prevent all these diseases. Memory loss can happen, there can be increase in anger and irritability levels, there could be sexual dysfunction, there could be so many disorders associated with sleep apnea. So anybody who is suffering from snoring should go to the ENT specialist and get sleep apnea screened.